Hello and welcome. Let's talk about plaster of Paris. So, what does it mean by plaster of Paris? Plaster of Paris is a type of the material based on sulfate hemihydrate, nominally CaSO4 half H2O. It is created by heating gypsum to about 150 degree centigrade. This is a molecular formula of plaster of Paris. This is a picture showing a roll of the plaster of Paris bandage. Now, mode of action. The plaster starts as a dry powder that is mixed with water to form a paste which liberates heat and then hardens. The plaster remains quite soft after drying and can be easily manipulated with metal tools. Now, medical use. Plaster is widely used as a support for broken bones. Plaster is also used within radiotherapy when making immobilization casts for patients. Now, complications of plaster of Paris. The immediate complication includes compartment syndrome and gangrene. The delayed complications are skin blister and ulceration, itching because of the desquamation of the epithelium which acts as irritant, disused atrophy of the muscle, localized osteoporosis of the bone due to loss of the movement, stiffness of the joint, and nerve palsy. Now, monitoring of a patient following application of plaster. Expose a newly applied cast to air circulation. It should never be covered because the cover will restrict the escape of the moisture and heat. Handle a wet cast carefully. It takes 24 to 48 hours for a cast to become dry and hard. Provide plastic covered pillows to support the cast along its interlength. Never permit the wet cast to weaken the cast. Rest directly on the flat or firm surfaces as this will flatten the contours of the cast and cause pressure. Review the patient's clinical record for the type of the cast and the region the cast has been applied. Instruct the patient on care of the cast that is wet and after it is dry. After the cast has cooled and begins to harden, elevate the casted extremity to reduce the swelling which often occurs after application of a cast. Observe all edges of the cast for any areas that cut or put pressure on the skin. Observe the extremity encased in plaster for circulatory impairment by comparing fingers or toes to prevent further complications. The circulation should be checked hourly during the first 24 to 48 hours, then every 4 hours. Check the skin temperature of the limb of the injured extremity and it should not be colder than the unaffected limb. Check and compare the pulses, this should be equal. Check for the complaints of the numbness, tingling, burning, swelling, pain, pressure, and inability to move the fingers or toes. Report presence of the above signs and symptoms immediately to avoid possible tissue necrosis because these findings indicate possible ischemia. Perform the blanching test. The nail beds of the fingers or toes are compressed lightly and released to check how quickly the color returns. End of the topic.